What is amenorrhea and eating disorders? Imagine your body is like a finely tuned machine that needs fuel and balance to run smoothly. When someone develops an eating disorder, that balance can get thrown off, and one of the signs is something called amenorrhea. This is when a person stops having their menstrual periods. It's a common sign seen in people with eating disorders, especially in those with anorexia nervosa. This happens because the body reacts to severe weight loss and not eating enough by changing how hormones work. The part of the brain that controls hormones, called the hypothalamus, starts to slow down or stop releasing certain signals. Normally, the hypothalamus releases a hormone called gonadotropin-releasing hormone, which tells the pituitary gland to send out luteinizing hormone and follicle-stimulating hormone. These hormones tell the ovaries to produce estrogen, which helps build the lining of the uterus and causes periods. In eating disorders, especially when someone is very underweight, the hypothalamus doesn't send out enough gonadotropin-releasing hormone. This means less luteinizing hormone and follicle-stimulating hormone are released. As a result, the ovaries don't produce enough estrogen. Without enough estrogen, the uterine lining doesn't develop properly, and periods stop. This is called hypothalamic amenorrhea. Other hormones are involved too. Fat cells produce a hormone called leptin, which signals energy availability. When body fat drops, leptin levels fall, and this also tells the hypothalamus to slow down hormone production. Additionally, levels of ghrelin, which stimulates appetite, can go up and further disrupt hormone signals. Sometimes, behaviors like purging or thyroid imbalances can also contribute to the loss of periods. It's important to know that amenorrhea can happen even before someone loses a lot of weight. It's seen in both anorexia and bulimia nervosa, though it's more common with anorexia. Sometimes, it's linked to other issues like polycystic ovary syndrome, especially in people with bulimia. In clinical settings, amenorrhea is a key sign that an eating disorder is affecting the body's hormonal balance. Restoring menstrual cycles usually requires gaining weight and improving nutrition. This shows how important it is to treat the underlying eating disorder to help the body recover. In short, amenorrhea in eating disorders is a sign that the body is reacting to starvation and energy deficiency by shutting down the menstrual cycle. Recognizing this symptom helps identify the severity of the disorder and guides treatment efforts.